tonight we will gather not for a politic but for a malam rapat antihistamines. So the voter tonight is patient with the allergic rhinitis, and the candidates tonight is from the oral antihistamine and the intranasal antihistamine. Each candidate will present the case highlighting mechanism, effectiveness, safety, suitability for our patient. So tonight we will vote for the best, not for popularity but for patient-centered evidence-based choice. And now let us meet the candidate.
Hi, I'm Citizen from our party. My manifesto are more affordable, provide steadily long-lasting symptom control, easy administration and convenience. With slogan, one tablet, multiple symptom relief, vote for me, Citizen.
Good night, ladies and gentlemen. My name is Azalasi, which is for Intranasal Antihistamine. My manifestos are rapid onset, non-sedative, low risk of cognitive impairment, and few systemic side effects. I will explain to you guys about my manifestos, and you guys need to wait and see.
My pharmacological class is not just a label, it is a promise. As a second-generation histamine receptor antagonist, my mechanism of action is true, while others focus on a single distal area, the nose specifically. I believe in unified body. I travel through the bloodstream to block histamine at the source.
Good night, innovators and sufferers. For too long, we accepted broad, cumbersome solutions for precise problems. My opponents offer a systemic overhaul when all you need is a targeted intervention. I represent the future, precision medicine, intranasal. My pharmacological class is not just an H1 receptor antagonist, it's an adult dual action agent. My mechanism of action is elegance in its directness. I don't just block histamine, I also exhibit potent anti-inflammatory effects right at the nasal mucosa. Why set a full army when a special forces unit can do the job better?
Providing therapeutic indications that cover not just allergic rhinitis but also urticaria and ETIs.
My therapeutic indications are clear: allergic rhinitis, specifically targeting nasal congestion, sneezing, and rhinorrhea.
Let's talk about my pharmacokinetics. My opponents called me slow, but I call myself steady. My onset of actions is deliberate, reaching peak plasma concentration within only 1 to 3 hours. But my duration of actions is my true legacy. I offer 24 hours of protection, no repeat sprays, no mid-day elections.
Let's talk about pharmacokinetics. My onset of action is my greatest strength, while others are being processed through the entire system. I deliver relief in 15 to 30 minutes. My metabolism is localized, meaning minimal system exposure. You get the benefits where you need them without the baggage elsewhere.
My suitability is my greatest strength. From the youngest children in our school to the seniors in our communities, my dosage form, whether a simple tablet or a pleasant syrup, I promise to ensure adherence for all of you. You don't need a mirror or a specific sniffing technique to use me. You just need a glass of water and the desire to breathe. So that's to believe my manifesto, more affordable, provides steady, long-lasting symptom control, easy administration and convenience. I am Cetirizine from our party. Grade 9.
And my message form is engineered for efficiency. I find this delivered directly in my required moment of focus, but that focus yields unparalleled results. This is about efficacy in the real world. My direct action means superior relief or nasal congestion, a symptom often poorly addressed by systemic medications. My suitability is for those who demand immediate, powerful control over the nasal symptoms without waiting for the long game.
So now we open for Q&A season. So if you have any question, you may ask now. Yes, you.
Hi, I am Aisha and I have a question for Mr. Cetrizine. I would like to point out about localize the nose movement. So if a patient's main problem is nasal congestion and sneezing, why should they expose their entire body to medication when symptoms are localized to the nose?
A fair question, my dear, but the body isn't just a series of signals. Allergies are a systemic immune response. By changing the whole body, I can prevent the symptom called. Today, it's a sneeze. Tomorrow, it can be itchy eyes or hard to wake up. So, let's just say I provide a national defense, not just a local border. Do you know what I mean? The next question.
Let's talk about safety. As someone who drives daily and works long hours, how can you ensure voters that the systemic effect will not impair alertness or safety?
We have moved past the drowsy era of the first generation, but first of all, let us give a round of applause for the first generation. My safety profile is highly negative. While no medication is zero risk, my second generation formulation is designed specifically to limit crossing the blood-brain barrier. I am the candidate of the working man and the daily commute.
I might have another question. This will be my final question for you. So, I would like to argue about your manifesto. Since you stated that you are convenient, how do you justify your nursing patients who are extremely sensitive to drowsiness or cognitive impairment?
Thank you for your question. For those sensitive swing voters, we adjust the budget, or whether we call it the dosage. We choose the least sedative options within my class, like fixofenadine. You can take fixofenadine. We justify my use because of the cognitive impairment of suffering from severe allergies is often worse than the mild side effects of the cure. My cost remains lower, my administration remains simpler, my result remains undisputed. So thank you for tonight. See you on the next day.
Thank you, Cetrizine, for your cooperation for tonight. So let us move to the next candidate from Intranasal Party.
Mr. Eslasni, your vision is open, but let's address some of the user experiences. You claim rapid onset and local action, but many patients complain about the mentalitis or nasal irritation. So how do you justify these side effects when oral options are generally risk-free and non-irritating?
Thank you for the question. A valid point. Some patients will experience a transient bitter taste and minor nasal irritation can occur. This is often due to the improper administration technique. We are constantly innovating patient education, but consider the alternative for severe condition. The relief I provide for outweighs these minor temporary inconveniences is a trade-off for speed and superior efficacy against stubborn nasal symptoms.
Okay, I have a final question. I would like to ask about cost. So given that intranasal antihistamines often have a higher upfront cost, how do you justify these to patients or formulary committees when more affordable oral options are available?
Oh, well, my cost reflects my advanced formulation and targeted delivery system. While the initial investment might be higher, consider the total economic impact. Faster symptom relief means fewer lost work days, fewer missed school days, and potentially reduced reliance on multiple other medications. The true cost-benefit analysis shows my value in restoring productivity and quality of life, making me a wise long-term investment.
Thank you so much, Azilasi, for your speech, amazing speech tonight. So now we move to voting part. So let us know who is your choice.
I have heard both candidates. If I value convenience and cost, oral antihistamines fit, but my nasal congestion is severe and I need to stay alert while driving. Therefore, my vote goes to intranasal antihistamines.
This activity taught me the importance of expecting patient's autonomy.
Ethical pharmacy practice require individualizing treatment.
Guideline guides decision, but patients values competing decision.
Our job is to support and educate patients so they can decide for themselves.
When they say,
One voice.
one evidence-based decision.
A decision making is the heart of a patient-centered care.
Follow these easy steps to get started. First, take off the blue protective cap and the safety clip. If it's your first time using it, or if it hasn't been used for 3 days or more, you'll need to prime the bottle. Point the nozzle away from your face. Hold the bottle with your thumb at the bottom and the nozzle between your fingers, then pump until a fine mist appears. Before you begin, gently blow your nose to clear your nostrils. Now, tilt your head slightly downward toward your toes. Close one nostril with your finger. Insert the spray tip about 1/4 to 1/2 inch into the other nostril. Keep the bottle upright and aim the tip toward the back of your nose. Sniff gently as you press the pump once or twice according to your dosage instructions. Repeat the process for the other nostril. For the pro tip, avoid tilting your head backward immediately after use. This helps prevent the medicine from going down your throat and leaving a bitter taste. Finally, wipe the spray tip with a clean tissue and replace the blue cap